I have just chaired the first meeting of the Greater Manchester COVID Emergency Committee. So I wanted to explain to you what that committee is seeking to do and how it intends to work. We propose to have a weekly meeting of the committee, 11 o'clock every Wednesday, and then there will be a press briefing at this time every week, 2 p.m. And that is something that we will put in place from today, and it will continue from every week from here. If it needs to meet more frequently, it will do. Just to say something about the role of the committee, it is not in any way to conflict with the advice that is being made available at a national level. In fact, it's to amplify that advice, and Kate will do that today to put a Greater Manchester face on the government's advice, and we are very much supporting the government in that important role, and making sure that we are getting the messages to our residents about what the government is asking people to do. The role of the committee, though, is more broadly to look at the system that we've got and to coordinate support across our 10 districts, and indeed services at a GM level, police, fire, transport, so that we've got maximum coordination and mobilisation of the support that people need. The committee's role is to identify any gaps that we can fill ourselves because of what we are doing, working with colleagues in the business community or in the voluntary sector, but also identify issues that need to be raised up to a national level. And I would stress again here, this is not to do it in a sort of a negative way. We're trying to add value to the national effort here to keep people safe from COVID-19. And if we're raising issues, it's because they're coming up from our organisations and from our districts, and we believe it will provide a way of getting early focus on issues that need to be addressed. And I'll touch on a few of those today, which came through our meeting. But I want to just start by running through a few of the things that we are doing as of now. The first is, from today, I've asked Sir Richard Lees to take charge of the health portfolio in Greater Manchester, to provide experienced oversight of the entire health and care system in Greater Manchester, and that will start with immediate effect. We are, secondly, looking at putting in place a support system for businesses. I hope a website might appear behind me, which is a business support service provided by our growth company, which is soon to be updated with information related to yesterday's announcements from the Chancellor of the Exchequer. We are soon to add a 24-hour hotline to support this website. So this is a business support system which our growth company are leading on, and we intend to keep improving it and extending it as things develop. But we would want to, through you, our colleagues in the media, make businesses across Greater Manchester, big and small, aware of this service and the advice that is being provided at the Greater Manchester level. Alongside a support system for businesses, of course, much of our focus now is on building a support system for people in our communities who may be at risk and who are not getting the basic support that they need. Now, this is a complex challenge, and we are not yet at the point where it's all resolved. But today's meeting helped us sort of flesh out the steps that need to be taken to put in place a support system for people across our districts. It's really important to say, as you're going to hear from Brenda in a minute, our councils are already doing this, and they are very much at the heart of this work. But it's recognised that the capacity of councils may not be sufficient to the demand that will be out there, particularly in the weeks and possibly months to come. So we recognise that we need to mobilise extra support to support our councils in this particular role of providing the basics to people in their communities. And that could be food, it could be medicine, it could be care, it could be a whole range of things that we need to support people with. So 2 specifics on that to add support to our councils. We've been in discussion with colleagues in Greater Manchester Fire and Rescue Service and indeed the Fire Brigades Union, and we have an in principle agreement that we will move to a safe and well telephone check service whereby we will use resource from within the fire service, and we're grateful to our firefighters for being ready to take on this role, where they will be able to help councils with the calls to residents who've been identified as possibly needing more support. So we can identify that support using that resource. Separate to that, we're also looking to then mobilise volunteers across Greater Manchester who may then be able to help with the response to those residents who say there is support that they need. So a separate website, I hope, is appearing, the community support system, and that is an attempt to provide a single doorway through which people wanting to volunteer to help can go, and they will be directed to organisations in the 10 boroughs who will be able then to take their details and then make them part of the resource available at that level for volunteer support. So this is part of the support system we are building for people. I would stress again that it's not the finished article, and there will be more that needs to be done to knit these different things together. And there's a potential offer from the Royal Mail, which Brenda will talk about in a moment as we bring in the various components of this. I suppose from me, the message to our residents in Greater Manchester is, as much as possible, not to worry. We, as always, the cavalry is there, and we're getting ready to come forward to support people. So, people who are worried about how things will play out over the coming weeks, I want to reassure them that we are kind of pooling our resources and our effort here, and we're putting in place the best support system we can to support all of our residents through this difficult time, and we'll keep you updated on how this support system develops. Just one other issue on support for people in this moment. We are in the process of opening more facilities for people sleeping rough, and particularly single room provision for people sleeping rough to self-isolate should they need to do so. And that provision will come on stream very shortly. The message to the public at the moment, if they are worried about somebody in their community who may need support, the advice is that they contact at this stage their local authority on the numbers listed for their local authority. That is the advice as of today. However, we are looking at standing up a Greater Manchester hotline as soon as possible, again, to add capacity to what councils are able to do at their level. And more details will be provided about that in due course. As I said at the beginning, the role of the Greater Manchester COVID-19 Emergency Committee is also, though, to identify gaps. And I just want to share with you some of the issues that came through our discussions today. And these are issues that very much came from the leaders of our councils, from the leaders in our public services. So, what we are wanting to do here is not kind of pick on random issues, but pick on the issues that are occupying the minds of most people in the Greater Manchester system, in the hope that the government will find that as helpful feedback and may be able to work with these proposals. The biggest single concern, I think, that came from the discussion this morning was cash flow for businesses, but also cash flow for councils. We believe this is going to become a growing issue in a matter of weeks, not months. It's urgent for some businesses, and Jürgen will say a little more about that. But for councils, they too now need the same treatment as businesses in many respects, in that they need cash provided urgently so that they can both use that to support businesses in line with some of the announcements made earlier this week, but also cash to run their own services, because councils are under huge strain at the moment, and we believe the government needs to turn its attention to this issue of cash support for councils. It cannot be ignored They've had 10 difficult years, and we cannot ask them to step forward and take on a leading role in holding people and communities together with regard to coronavirus if they have not got the resources in the bank to be able to provide that expanded role. So that is a very clear message back to the government. It's cash flow for businesses, but it's cash flow for councils too, and we believe that needs to be addressed. Urgently. The second issue which came from our discussions today was the question of personal protective equipment for public service staff, but also the testing of staff and a significant increase in testing of frontline professionals. On the question of PPE for staff, there is an issue with health service staff, but we understand there have been moves recently to unlock the national stockpile of PPE for staff working in the health service. There is a suggestion that this is about to happen for social care staff, although the message from today's committee meeting was that it's not yet clear enough for social care staff, and the government needs to move more quickly to put in place clearer arrangements so that staff in care homes and those working in domiciliary care can also access that commitment so that they can go about their work with a sense of safety, both in terms of their own safety, but the safety of people in their care. And the question of PPE for social care staff needs to be addressed urgently. But, and I'll maybe ask Nick to say something about this later on, there is the question of PPE for other public services staff, and particularly police officers. We understand that police officers are attending incidents where there may be a health concern, but currently do not have access to that equipment, and consequently some may not feel able to attend those incidents. So this is an issue that does need to be addressed urgently by the government, alongside the capacity to test staff, particularly in the health service, who may fear they have the symptoms of COVID-19. And the message today was that we need a more urgent decision on the suspension of screening programs to free up capacity so that the testing can increase. And again, that's a message that we would ask the government to take on board. The third issue that came up is the question of schools and school closures. There was consensus around the table that a decision needs to be taken pretty urgently now about schools, and we understand that the government are on the verge of making a decision. We would support the decision that's been taken in Wales and in Scotland, which would be to close schools from this weekend. But we would also support the idea of schools maintaining a skeleton staff to run schools from next week for students who are the sons and daughters of staff working in the police service, the NHS, or other crucial services, because that is clearly an issue, or those who would have no choice other than to be with grandparents. And of course, that is not something that we can advise at the moment. So we would say that schools should close from this weekend, but we would encourage the government to consider a skeleton operation from next week to provide that place for the children of essential services staff, or indeed those who can't be with grandparents, give them a place to go. We also believe that schools should be available for children on free school meals who may not be able to have access to a meal if the school is closed. And we believe that should be something that is kept in place over the coming weeks, even through the Easter period. Beyond the issues that I've raised, there is again a feeling that there is a significant gap here for people who are renting their accommodation, and that needs to be addressed by the government. And still, we do not believe sufficient arrangements are in place for for people in low-paid, insecure employment. And this, again, is an issue that needs to be addressed urgently by the government. But I'll finish what I've got to say by just wanting to put on record the thanks of all of our leaders across Greater Manchester for the workers in our public services, particularly in the police service, the National Health Service, social care, Greater Manchester Fire, and indeed in our councils, for the way in which they are rallying round to support people at this particular time. We've also had fantastic offers of help from the business community, and we're extremely grateful for those, as well as our voluntary services, and indeed the Greater Manchester public, who are, as they always are, stepping forward and offering to help, and we're extremely grateful to them. And just to say, we appreciate all of us how difficult the job is that the government has got to do at this particular moment in time. Our aim in bringing together people in the way that we are is to support the government in that role, to amplify their advice, but also to provide that intelligence on where people perceive the gaps to be from the grassroots upwards. And we think this will help the national response. And lastly, I need to thank all of you for being here today to allow us to get our message out to the Greater Manchester public, and hopefully onwards to the national audience, so that we can continue to build the British response to COVID-19, make it as strong as we possibly can, work across geographical and political lines, and put the country in the strongest position possible to fight this virus. And that is what we are doing here in Greater Manchester, playing our part, and I'm extremely grateful to everyone who is doing their bit to make that happen. So if I could finish there and hand over at this point to Professor Kate Ardern, who will provide the health perspective and, of course, reiterate the messages that the government have been making this week. So, Kate.
Thank you, Mayor. Good afternoon, ladies and gentlemen. As you know, the UK is now in the delay phase of our UK plan to tackle COVID-19. That means we are taking measures to try and delay the spread across the community. The measures that were announced on Monday by the Chief Medical Officer and the Chief Scientific Advisor are about social distancing. So they are a change and new measures. If you live alone and you have the symptoms of COVID-19, which are a new continuous cough and or a high temperature, by which we mean a temperature above 37.8. If you live alone, you should start, however mild your symptoms are, you should stay at home for 7 days from the time your symptoms started. If you live in a household with others, and either you or another member of the household shows symptoms of COVID-19, then all household members must stay at home and not leave the house for 14 days. The 14-day period starts from the day when the first person in the house becomes ill. There is no need to ring NHS 111. We would certainly strongly advise you not to go to your GP or pharmacy or indeed to a hospital, but stay at home. If your symptoms get worse or you are worried about your symptoms, please use the NHS 111 website, first of all, or if you're not online, then phone NHS 111. So if your symptoms worsen. The other advice that's been issued is to groups within the community who are particularly vulnerable. And I would at this point like to re-echo the Mayor's message around personal protective equipment and infection prevention control. Some of our most vulnerable residents in terms of COVID-19 are older citizens. So everyone over the age of 70 has been asked to socially isolate themselves, distance themselves for a period of 12 weeks. Obviously, some of our most vulnerable citizens are residents in care homes or in receipt of domiciliary care, which is why it's even more important that social care staff have access to adequate PPE. We want to make sure that those citizens are as protected as possible from potentially contracting COVID-19. There are other groups within the community under the age of 65, for example, asthmatics, diabetics, and pregnant women, along with citizens who have immunocompromised conditions who have also been asked to take more strict social distancing measures. The full list of those conditions are on the government website, the phe.gov.uk website. So please read that, look at that for further information. And indeed, NHS England will be contacting very specifically individuals who have been, for example, in receipt of transplants recently next week. That was part of the messaging yesterday. We would want to reinforce those messages. In Greater Manchester, we have very tried and trusted plans for outbreak management, which form a significant part of our preparedness for COVID-19 and are also based on our experience in 2009 with the swine flu pandemic. We have tried and tested mechanisms through the Greater Manchester Resilience Forum, and I would like at this point to pay particular tribute to the work of our infection prevention control teams across the NHS, local government and public health, and the work of my public health colleagues in the 10 boroughs who are leading the borough-wide response to COVID-19 in Greater Manchester. The other messages I would want you to try to think about in terms of preparedness for COVID-19. Again, I would reiterate the strong messages around hand and respiratory hygiene. Washing your hands for 20 seconds in hot water and soap. You can sing Happy Birthday or any other tune that you feel like that makes you wash your hands for longer. Making sure you get in between your fingers, washing the backs of your hands and your wrists. Very important. Please do not touch your eyes, your nose or your mouth with unwashed hands. That's the quickest way to actually transmit viruses. So frequent, regular hand washing, particularly before you handle food or indeed you have touched surfaces. Very, very important. Keep the house clean. Normal detergents will work on surfaces. And respiratory hygiene, also very important. Again, a good message from 2009, catch it, bin it, kill it. If you sneeze or cough, make sure you have a paper tissue to catch your sneeze or cough, or in worst case scenario, use the crook of your arm. And then please dispose of the tissue hygienically and wash your hands. That is the best way to reduce transmission of COVID-19. Thank you.
Very clear indeed. Thank you very much, Kate. Jürgen, would you mind providing an update from the business perspective, particularly on the very welcome measures that the Chancellor announced yesterday, but also in the space where you might think more is needed? So over to you, Jürgen.
Yeah, thank you very much, Mayor. And this activity of the Greater Manchester Crisis Committee is very much focused on trying to make sure that as much as possible there is a coordinated message and support mechanism out to our businesses that is delivered, of course, nationally and locally. The Mayor has already pointed to the website of the Greater Manchester Business Growth Company, and indeed there is already some excellent advice on there, such as how to work with supply chain problems, on cash flow issues. We also want to make sure that we as a business community are speaking with one voice in terms of the support that we require. And to the Mayor's point there, the business community is indeed delighted that what really is an unprecedented and unbelievably difficult situation, especially for many small businesses, is being met with an unprecedented response. 350 million of loans made available, that is something that is unprecedented, and I think it's the sort of thing that the business community is very, very happy about. Having said that, I know you have already heard this as well, but there is a very common message coming, and we are already getting messages from businesses that are seeing very, very quick distress because when your pub, your restaurant is literally got no customers coming through the door and no revenue, cash flow, it becomes a problem very, very fast. And that could well become an issue before loans are able to be processed and come through. So our request is very urgently that we need some real cash flow, immediate measures, which of course can be delivered through business rates. There has already been some welcome news on that, but if that could be extended to further sectors, and then there are areas such as VAT payment suspensions, or various PAYE tax suspensions. It's those immediate helpful tax measures that we are looking for. And then the second thing I just want to point out, which is not quite as immediate, but is fundamentally critical for what is a much, much more urgent crisis than we faced in any other recession that I have seen, and I've seen quite a number of recessions and helped businesses manage through them in my years here in the UK. But this is unprecedented, and I think this is the one where we are going to need to have a short-time working retention scheme or a compensation scheme where companies are needing to put people on short-time work, that there is an instant government scheme that supports at least a part payment to those staffs. These are schemes that are well known about, well run in many other countries around Europe and in the world, and I think we're going to have to put something in place. And the reason why that is so important is because when there is an upturn, we need to have that capacity available to let the economy move as quickly as possible and thrive again. And maybe if I'm just allowed to say one final point, I don't want this to come over as this is, you know, just an ask of lots of support for business. That is critically important. There's items that I just mentioned as examples, but I also want to make the point how critical business is to be part of the solution to this problem. We've just heard about the requirement for deliveries, especially to vulnerable people. We've heard that the post office is going to step in and provide that emergency services. But actually, you know, I live in Didsbury just down the road, and there is a very effective and local milk, eggs, very basics, the old sort of milk delivery service, you know, to help those sorts of businesses be able to expand to vulnerable people. There is digital capability, which needs to be built. You know, we're already seeing that everybody working from home is meaning that some of our sort of web-based communication services are not quite as robust as they need to be, and businesses working at an unbelievable pace to help make sure that those systems become resilient. Those are just a couple of what is going to be many, many examples. So this is why it's so important we really help enable the business community to be part of the solution and to make sure we get through this incredibly difficult period together. Thank you.
Thank you very much indeed, Jürgen. As I was saying, we've already had a huge number of offers of support from the business community. And there's indeed a suggestion that has come via Sasha Lord that restaurants may be able to kind of pull together in a network and provide a meal service across our district. So these are the kind of ideas that are in early development, but they're worth mentioning just to give people a flavour of the work that's going on behind the scenes. We can't give everything to you today as a finished product, but I can assure you there's a huge amount of thinking going on about how we create new networks of support, and these are being developed at pace and scale. I want you to hear the local authority perspective because you know, this is a very, very, very challenging moment for councils. But as ever, they are going above and beyond to do everything they can for their residents. And Brenda Warrington, leader of Tameside Council, is leader of a council that has got a fantastic track record of doing this. And I think it's going to be very helpful to bring the Tameside experience to bear on Brenda's work for older people across Greater Manchester. So we're really glad to have her with us today. Brenda, over to you.
Okay, Andy, thank you very much. And I think one or two of the things I may mention have already been mentioned, but I don't think it can be stated often enough. The local authorities, quite frankly, see one of the main things that we need to do in this particular crisis situation is to actually build up that support system, in particular for our vulnerable people, and we have them all across Greater Manchester, for all variants of reasons, whether it's age-related, disability-related, mental health-related. There are many, many people who currently live in, you know, some kind of difficulty day by day. And we want to make sure that they are well cared for and well protected. And that goes across the whole of Greater Manchester. And I think it goes for all of the local authorities when I say that we have a responsibility to do our best to help protect the public, but we also have a major responsibility to best protect public sector workers, and that's whether they work for local authorities, whether they work for the police or the fire and rescue. Whatever their work may be, we have a duty to them as well, and we mustn't really forget that. And local authorities, ever since the COVID-19 became a major issue for us, have been working behind the scenes in many cases, but looking to build up, each of us doing it in our own areas initially, but what we're doing now is we're starting to share our practices, because it's not impossible that, you know, something that another authority may have started to do, we may think that's a great idea, you know, we want to adopt that as well. So we are sharing best practice, and we are making sure that we do keep each other informed. We are setting up hotlines, because we feel that people, rather than phoning in perhaps to the regular council exchange, you know, you never quite know, you know, which department you may get put through to. We're setting up particular hotlines for anyone with an issue relative to COVID-19, which I think will be very helpful to many people. We're also looking in each district to set up a hub, a physical hub, where people can perhaps go to make sure that they're getting the best advice and the best care that's available to us. But of course we have identified many concerns, many issues, not just that people are bringing to us, but of course issues that local authorities have in being able to provide that excellent service and protection to our residents. And one or two of them have been mentioned already. The social services sector, again, working absolutely brilliantly across the whole of Greater Manchester, have major issues. We don't have the testing, we don't have the PPE that we know that we desperately need, again, to protect those workers and to make sure that they can continue to provide that service. Because the last thing that we need is, you know, hosts and hosts of our workers having to self-isolate or becoming ill as well with this virus and not being able to provide the service, because that would be a real difficulty for us. Our care homes, of course, major concerns there, because the people that live in the care homes clearly are those people who are at the older age group, some of them having underlying conditions, some of them already being ill. And so what we need to do is make sure our care homes have the best possible advice and the best possible support to continue to offer the service that they do to their vulnerable clients and residents. Now, one of those things may be, and that's not happening at the moment all over, but it may be that they have to consider, if they do detect an active COVID sufferer, that they have to restrict visitors, you know, going into that particular care home. But again, one of the difficulties we have is because we don't have the testing facilities and the PPE facilities, it does make that particular job that much harder. So I do welcome, Andy, the fact that we are going to press very strongly to government that it is absolutely vital that local authorities are able to access these kind of facilities. We're having to deliver our services differently, and again, all local authorities have already begun this. We've already identified what we need to do, again, to protect our workers, to protect our residents. And the kind of things that have already started to happen, it's not wholesale everywhere, but I think it may well be before long. But for example, looking at all public venues that are run by local authorities, places like libraries, places like theatres, places like museums, you know, it is highly probable that some or all of those kind of venues, we may need to make those difficult decisions to say, look, I'm sorry, to protect the public, to protect the workers, we can't allow those to be open at the moment, you know, until this, we feel that the situation has changed. So that may be something that is happening already. If it isn't in any local authority, then my suggestion is that it may well begin in the not too distant future. And I think communications is something that is so vital, because I think a lot of the fear that I hear from people is not because of the virus particularly, it's because of the lack of information, the lack of knowledge that they have relative to what's expected of them, what is available, what's not available. And of course, some of those concerns are not so much the virus itself, it's the impact. It's if my employer has to close down its operation, or even if my employer is no longer able to continue in business and I no longer have a job, how on earth do I pay my rent, my mortgage? How do I support my family? That is a very, very real concern. So I do welcome the advice from the business sector, and I do welcome the suggestion from the Chancellor yesterday that there is support out there. What we need from government at the moment, though, is the detail around those announcements that were made yesterday. Very, very welcome, but we need that detail because, again, local authorities, Andy alluded to it, we are already very cash strapped, believe me. A lot of local authorities, we've done so much over the last 10 years to change the way that we deliver services, to try to make sure that we meet our budgets. We've had to, make some difficult decisions, but we've done it. And most of us are at the point where we don't have a lot of reserve. We really don't, have the ability to sort of start to offer cash incentives to anyone at the moment. So again, we welcome the fact that the Chancellor did say yesterday that there would be support for local authorities. What he's not yet told me is what that support is going to look like and when we can expect to receive it. Because, of course, don't forget that a lot of people rely on local authorities, they rely on the councils for financial support in times of hardship. So we have to make sure that we're able to still offer that. We have to make sure that those people who are going to have a very, very difficult time, and they are at the difficult area of our population, again, across the whole of Greater Manchester, where they don't necessarily have savings, they don't necessarily have a lot of money, to sort of play with. And of course, what they are going to find is that very quickly they'll find themselves without the means to continue to live in the way that they should. The school situation is a major worry for local authorities. Again, it's been alluded to, but we know that what will happen, and one of the things that worries me tremendously is that, again, we have some of our looked after children particularly, but other children too, who rely on a free school meal. And of course, if the schools close and that meal isn't available, then we have children that are not going to have adequate nutrition. That is a worry. We are already starting to look at how that can be dealt with, what we can offer, if you like, to families who find themselves in those kind of situations. And one of the things that, again, has happened quite quickly is volunteer support. Lots and lots of people all over. We see it on social media all the time, offering their support to do the shopping, to help out. And this is very, very welcome. But what we need is to coordinate that support. And again, we need to do that on a district by district basis that is overseen, I think, by the Greater Manchester Combined Authority as well, so that we know that we're getting the right support, going to the right people at the right time in the right places. One of the things that worried me tremendously was a suggestion that I saw that people should tie something on the door if they need some help. And I just think that is a recipe for lots of unscrupulous people to take, unfair advantage of a vulnerable person. So I wouldn't suggest that. We need to do this properly, and we need to make sure that the volunteers are really well used in the right places. But again, the reference to Royal Mail, I think it's tremendous that our Royal Mail partners are actually offering to work with us. And that would be perhaps to deliver food to, again, vulnerable people in isolation that can't get out the house. And, you know, we can do that very effectively, again, making sure that it's coordinated via the local authority. I think what I would say is that at the moment, I believe that we're all dealing with all of the issues, all of the concerns in a very measured way. There's no panic as far as we're concerned at this level, but I do know that there are little bits of panic going on out there, and what we have to do is make sure that we can provide that reassurance to people that we do have plans, we are able to help, and we must make sure that everyone knows how they can access that help. Because as council services stop providing service on a face-to-face basis, such as customer service and other maybe job centres and citizens advice, etc., I think we have to make sure that people know that that service is still available. It hasn't closed down. It's just going to be accessed in a different way. Maybe by phone, maybe by internet, I don't know, but there will be means and there will be information. Again, we've still got to tie a lot of these things down. We've still got to make sure that we're getting the right thing out. But I would like to say, just as Andy has said when he closed, was we have to thank all of our public service people, because they are doing, believe me, a tremendous job. They are prepared to be taken away from their normal work, to be put onto other work where it's more essential. Many of them are working from home. Many of them are making sure that they're providing still that same service, but in a very, very different way. And they're all working tremendously hard. Our volunteers too, we have to thank. And certainly, I think that with the support of everyone, we should really, we'll get through this. I'm convinced that Greater Manchester will find ways to get through this, despite all the major issues that we know are coming before us, because we know there will be some. We haven't got all the answers, but we certainly are making sure that when we get the questions, we are reacting to them, we're dealing with them, and we are finding solutions. So we'll continue to do that, Andy, as you say. We're having daily meetings and making sure we're kept each other informed.
Thanks very much indeed, Brenda. So you've had a pretty comprehensive perspective from the different sides of Greater Manchester here. So I'd now open the floor to any questions. I have some that have been submitted from colleagues who couldn't be here because of self-isolation. So colleague behind, and then come to the colleague in front. Yep.
Tom Palmer from Sky News. Mayor, have you had a direct conversation with the Prime Minister this week, and if so, what came of it? And secondly, what would you say to people who are right now and this evening gathering in pubs and bars around Greater Manchester, continuing to ignore the advice?
So the answer to your first question, Tom, is no, I haven't, but nor would I necessarily have expected to have one. I did deal with swine flu for the then Labour government 10 years ago, so I have some understanding of what the government is having to deal with at the moment and the speed with which things are changing. This situation, of course, is much more serious, I think, than swine flu ever was. Even though swine flu was a serious situation, this situation is presenting more challenges. I did make a call on the government to move to daily briefings at the weekend, and they've done that. I have suggested the separation of experts leading the advice, and that's why Kate has very much led that for us. We are not straying into that world, and I think that is the way that it should be done at national level too. Keep advice in the hands of clinicians and let the politicians talk about mobilising of support. If the Prime Minister was to ring me, I will of course refer him to the issues that I've just raised, but also to develop the international collaboration around a vaccine. That was something that occupied a huge amount of my time back in 2009, and I would recommend that. But no, I don't expect to be called. But I would say that we do notice that the Mayor of London is part of the Cllr arrangement. I think that should be made available to not myself necessarily, but others who can speak for other parts of the country. As this develops, I think the government does need to open out the discussion a bit more broadly than it has managed to do so far. That's not a criticism, it's just simply as we get into the more complex phases of this, I think perspectives from all sides of the country need to be heard, and obviously we're making our perspective heard from here today, but we want to very much do that in the tent, if you like. We are not here to criticise the government. We understand how difficult their job is at this time. We are here to help, but we can probably help more the more that we are brought into the discussions that are going on at a national level. On the point about people still going to the pub, well, maybe I'll defer to Professor Ardern on this point, but that isn't following the advice that's been given, and even though it's difficult for our businesses, we would say that the advice very much should be followed at this particular moment in time. Kate, is there anything to add?
Yes, I would definitely urge people who are still going to pubs or clubs and restaurants, however hard it is for our businesses, this is about protecting both themselves and their loved ones. And I wouldn't want to see or wouldn't want to think that people are not taking those social distancing measures seriously. This is the best thing you can do to actually protect your mum, your dad, your grandparents. So please don't continue to go on as normal in terms of visiting the pub. Respect the advice on social distancing for yourself and your families.
Nigel Barlett from about Manchester. It's to Professor Kate, actually. The Prime Minister said yesterday that London was ahead of the curve when it came to the contagion. Where does Manchester stand in that?
Right.
Just before you do, Kate,
Yeah,
and that's okay. People on live feed can't hear the questions. So the question was from about Manchester, London being ahead of the curve, and the question was, where is Manchester on that trajectory?
Yes, that's fairly typical for an outbreak, that you don't see it happen evenly and in even distribution across the country. It does tend to happen in hotspots. So at the moment, London, Hampshire and the home counties are seeing more cases than anywhere else. We currently have 54 confirmed cases in Greater Manchester. So that's across all 10 boroughs of Greater Manchester.
We have a question that's come in from Jennifer Williams at the Manchester Evening News, so I just want to answer those for colleagues who can't be in the room today. Is Greater Manchester short of PPE? I'm going to ask Nick to take that in a moment. Question more for me, what proportion of tram and bus services will be cut, and from what date will that happen, and when will a decision be made? I am considering these matters at the moment, and obviously the transport system is facing difficulties as any other part of the public service or business community is. We will, I think, at some point have to move service frequency back, both in terms of buses and trams. There are discussions ongoing with the bus operators, and I'll update people on those soon. There is an expectation possibly of a Sunday service coming in the not too distant future. With regard to the tram system, the idea that hasn't yet been finalised, but I'll just in the spirit of openness share it with you. There is a suggestion that we might reduce frequency of tram services from 6-minute to 12-minute services, but in doing so, we would be able to provide double trams so that would allow people to have more distance from each other on the tram system. So that's where we are with it. I would imagine that we will be moving in this direction, but as soon as the date has been confirmed, we would, of course, let people know. Nick, would you answer the question about is GM short of PPE, personal protective equipment, and particularly maybe say a little more than I was able to about this issue of police officers finding themselves in situations where they would ideally want to be wearing it but don't have access to it?
Yes, certainly. Thank you, Mayor. I represent in this role as the chair of the Greater Manchester Resilience Forum the collaboration of partners coming together to deal with a crisis or an emergency. And there's no getting away from the fact that we all want our National Health Service colleagues to have access to that protective equipment. to ensure that they do not pass on germs to the people they're trying to treat, but they also protect themselves. And we've heard that social care, quite rightly, protecting many of the vulnerable in our communities, need to have access to that PPE for the very same reasons. But as a police officer, and looking at the incidents that we are starting to attend, they are frequently becoming more and more identified as incidents with COVID. So that may be a crime, that may be domestic abuse, that may be, tragically, a death in a community, where our officers have to attend, and they have the same concerns. One, in terms of any transfer of disease that they may have, which they may not know about at the time if they're going to an elderly, vulnerable person. And likewise, if they go into a house which is in self-isolation to deal with an unrelated matter, the concerns for their own well-being. And my officers represent, like the rest of the community, people who go home to pregnant wives, grandparents, elderly parents. And so what we are seeing is that we have access to some of that protective equipment, but the provision for appropriate masks, the water repellent mask, is certainly something that is missing in terms of provision for our police officers. And whilst it's sort of minor incidents now where risk assessments can be made, we anticipate as the curve increases, so will those number of incidents. And so it's really important that we are trying to risk assess incidents, asking the public to think twice about having attendance of the police where there is not an immediate threat and risk. But we also are seeking through our procurement channels to increase the levels of availability of PPE to police officers. And likewise, I know my colleagues, slightly different situations in the fire and rescue service, where there are other times where they are more engaging with the public, they too need access to that level of equipment. So that's the only thing I'll...
And that's a very clear message from Greater Manchester today. All public services, we would think, would need some access to the national stockpile of personal protective equipment. But beyond health and social care, and those issues aren't yet resolved, the police service, I think, needs to be considered much more urgently than has so far happened. So that is a message that we are asking the Prime Minister and the Chief Medical Officer to take on board, and we would hope to hear more about that at the daily briefing taking place later today.
I'm Simon from the Revolution 96.2 and Ardern Chronicle. What can you say, or what's your message to sort of small local businesses like ours? We have sort of 10, 15 employees at our place, so what's your message to kind of end these tough times?
It's a very worrying time. I understand that for any organisation of that kind of size. We have been advocating for you to a national level. That was the message coming through our growth company last week, that businesses were on the brink of running out of funding. And I think you've heard it again from Jürgen Maier today. The measures announced earlier this week, as welcome as they are, may not be in place to save organisations that really kind of run on a cash flow basis and might not have enough to be able to tide them through. So that was very much the message today, that there are organisations out there that are vulnerable today and are close to running out of money and laying off staff. And once they're gone and won't easily be brought back. So the message from the Greater Manchester COVID committee today was very clear. Much more needs to be done on the cash flow of those organisations, and indeed councils as well, who might be asked to support those organisations. And we feel that while things are positive in terms of what have been done recently, they're not yet enough, and they are not sufficiently urgent. And we would ask the government to take that on board.
Maybe if I can just add one thing to that, which is another thing that we are going to do, is to help coordinate the professional advisory community. So, the the banks, your tax advisor, and all of these people, you know, to make sure that everybody is as up to date as possible of how the various support schemes are going to work, and so that we can get those support schemes out to businesses as fast as possible, you know, in terms of the loan application process and that, so that doesn't turn into, you know, a huge bureaucratic, difficult process. We're going to try and make all of that sort of thing as easy as possible.
Any last questions? Yeah.
From the Press Association. I just wanted to ask more about the fire service. What kind of tasks will they be doing to help the vulnerable people? And will you be able to make sure that doesn't put a strain on the services they're already providing, given they're probably facing the same problems with self-isolating?
Yeah, no, so it's a very good question. So our fire service here in Greater Manchester for a number of years now have operated a system called Safe and Well checks. So these are home visits where a very wide-ranging inspection, discussion can take place. So there is already a capability that's been built in terms of that. What this is about is seeing if we can move those to more telephone consultations and perhaps not be as wide-ranging, but much more of a direct personal support to people, asking them about the circumstances they are in right now. You know, do they need more support? If they do, what is that support? You know, can we get it to you? Not necessarily saying the fire service should do that, but that's, you know, it's to help make those phone calls across districts to the people identified by our councils as possibly in need of support, and that work is now ongoing, about having a kind of list of people at a local level who might be the people who need to be contacted. And the feeling from our councils is that there isn't sufficient capacity in our councils to be able to make all of those calls. Bear in mind, this could be with us for months rather than weeks. So that's the discussion. We've got an in-principle agreement from the fire service that they can move towards a service of that kind. We've also got an agreement with them around overtime to help cover staff shortage. The offer from the Royal Mail is very interesting in this context as well, because now we might be able to knit together, you know, what the councils do to identify people, what the fire service might help us do to get then the direct contact and the needs that people have, and then with the offer of the Royal Mail with more delivery, that then becomes a system, if we can knit it together, that might support people on a much more, you know, is a much more structured way to supporting people on an ongoing basis. So it's early days, as Brenda said before, we haven't got all of the things completely in place yet, but we felt it was important to tell people that this system is in development, because at the moment there may be people at home who are running out of food or running out of essential supplies, beginning to worry about, well, what's going to happen to me in a few weeks' time. And the message to them today is we are working on it. As I said, the cavalry's coming over the hill, and we hope it will arrive soon, and we'll be able to give a much fuller answer at this press conference next week.
Andy, can I just add?
Absolutely, Brenda.
One of the things that the local authorities are doing now is they are compiling lists of people who fall into certain categories, let's say. And I know in my own authority, we've got almost 10,000 names on this list. And every single one of those people will receive a telephone call, again from a bank of volunteers who will have a script, you know, and questions to ask, to make sure that they're okay, whether they need anything, whether they need any help or support. And so that kind of thing is one of the ways that we will be making contact with those people that are deemed vulnerable.
And it's important to say, I think one thing that is being missed in the national debate at the moment is the question of people with severe disabilities or complex needs, parents of children with severe underlying conditions. We think more needs to be said to address those groups directly. And I don't think at the moment they are getting the direct advice that they need, because they need more specific advice than has so far been given out. Now, I think that's a fair point, Kate, isn't it? I don't
Yes,
know whether
it
you
is.
could pick that up very briefly.
Yes, it is. And just to echo Councillor Warrington's point, that actually our social care staff and social services staff are working very directly with, for example, foster carers, with the parents of children with complex needs, but also our vulnerable working age adults, as well as older people in receipt of social care, to make sure that very specific needs of carers as well, are addressed in terms of our social support, our civic support, and the community wraparound to support those households that have to isolate or may have particular challenging circumstances. So that's absolutely part of what every local authority is doing, and we are supporting that with, for example, very specific infection prevention control advice and support to those households as part of the social care offer and local public health offer.
Is there one final question, colleagues, before I bring things to a close? Conscious that some haven't asked one. If not, can I thank you all again for your attendance, for what you are doing to help us get these important messages out at this time, and can I encourage you to attend this briefing every week as we strengthen our response to this situation that we all find ourselves in. So thank you very much indeed, colleagues, and thank you to all of the panellists who've spoken. Thank you.